Good afternoon, and thank you for tuning in to Rattler News 850. I am Taylor Payne.
I'm Renette Ricks.
I'm Winsika Neptune.
I'm Gadil Beck-Jones.
And in today's segment on What's New in the News, we will be discussing the Iron Triangle,
cultural competence and cultural humility,
Health disparities,
the Affordable Care Act.
So going back to the Iron Triangle. The Iron Triangle is a systematic system that is tightly interlocked and works on the basis of components, which are access, cost, and quality. This idea of a self-reinforcing and interlocking means that improving two of the components will always result in the worsening of the third component. For instance, you cannot improve access and the quality of healthcare without sacrificing the cost. So when working in an Iron Triangle, people have to be aware of this essential trade-off that takes place. The self-reinforcing trade-off is definitely unavoidable. And so with that being said, the Iron Triangle has a direct relationship to the health disparities that people face in the United States. One of the main issues that arises in the discussion of health disparities is the issue concerning access to healthcare. Many people have difficulty accessing quality healthcare, which ultimately perpetuates certain health crises in some low socioeconomic areas. The Iron Triangle is directly related to this disparity because if access is improved for these areas, the cost and quality of the healthcare will be worsened in the trade-off. This specific health disparity was addressed in the construction of the Affordable Care Act, and the trade-off was proven true because once the Affordable Care Act did take place, the cost and quality went up when increasing the access to people. Back at you, Renette.
Okay, so today discussing cultural competence. Cultural competence is the ability to interact effectively with people of different cultures, being able to interact with different cultures to make sure that every member of the community's needs are addressed. Understanding and responding to cultural variables such as race, religion, sexual orientation, socioeconomic status, and gender is what cultural competence consists of. These variables are important to understand when there's a professional and client interaction. Cultural competence is also seen as a foundational pillar for reducing disparities through clinical and professional unbiased quality care. The Department of Health and Human Services established national standards for cultural and linguistically appropriate service to improve healthcare in the U.S. The benefits of cultural competence in healthcare improves the outcomes and limited sources increase in customer retention to access care. Also, as far as cultural humility is understanding in regards to cultures, having the humility to be able to consider someone else's cultural and background. Understanding someone's culture and background, it will allow you to see things the way others do. The difference between cultural competence and cultural humility is that cultural competence is actually knowing someone's background and cultural background through actually studying and actually being able to use that in your client and professional situations. Cultural humility is actually being able to understand that you don't know everything about someone else's culture. So you continue to ask questions and always know that you can learn to benefit their healthcare that you're giving them, or to either eliminate the healthcare disparities that's present in the communities today. Now we'll go to Winsika.
healthcare disparities are the inequalities that occur in provision of healthcare and access to healthcare across different racial, ethnic, and socioeconomic groups. Despite improvements, differences persist in healthcare are the inequalities that occur in provision of healthcare and access to healthcare across different racial, ethnic, and socioeconomic groups. Despite improvement, differences persist in healthcare quality among racial and ethnic minority groups. People in low-income families also experience poor quality care. Certain races have genetic predispositions for certain diseases, and that fact cannot be changed. However, the difference among race for things such as treatment, access to healthcare, and availability of medicines should not be as great as they are. One of the most important disparities that exist between racial ethnic group is access to care, especially how access care is limited due to treatment not being tailored to the needs of different minorities. Today, many groups face significant disparities in access to and utilization of care. People of color generally face more access barriers and utilize less care than whites. For example, among non-elderly adults, Hispanics, blacks, and American Indians and Alaska Natives are more likely than whites to delay or go without needing care. Race and ethnicity should not be decided by levels of social insurance individuals get. Certain races have hereditary inclinations for specific sickness that reality cannot be changed. Certain disparities in access are also common. Blacks had worse access to care than whites for 1/3 of core measures. Hispanics had worse access to care than non-Hispanic whites for 5 of 6 core measures. Poor people had worse access to care than high-income people for all 6 core measurements. Thank you.
In the last 50 years, that the United States has improved access to health care and increased the number of Americans who receive health insurance through their jobs or other programs such as Medicare or Medicaid. Despite this development and progress in the system of insurance and access to health care, still there are a lot of people, especially in community of color, didn't get this development. Lack of access to adequate insurance lead to severe consequences related to a person's health, quality of life, and the community of health in general. All people, regardless of gender, age, cultural background, disability, or religion, deserve the high quality health care. Many provisions in the ACA related to health disabilities affect insurance. The National Center for Biotechnology Information stated that under ACA, insurance will provide plans and health insurance exchange marketplace, and all insured patients must receive culturally and linguistically appropriate information on appeals procedure and explanation of coverage. The Affordable Care Act will reduce health disparities by investing in prevention and wellness and giving individuals and families more control over their own care. To achieve this, Affordable Care Act has produced 2 strategies. First is national strategy for quality improvement in healthcare, which will include priorities to improve the delivery of healthcare. The second strategy is the National Prevention and Health Promotion Strategy, which aims to bring prevention and wellness to the forefront of national policy.
Okay, as a quick recap, I'll go ahead and talk about cultural humility and cultural competence one last time. Cultural humility is just being able to always know that you can always learn from someone else. Always knowing to reach out and to find out other things that you can learn to help improve someone's health care they're receiving, or find out what's hindering them from having the best health care as possible. Cultural competence is actually being able to, for example, learning a language to further assist somebody if they're your client. That's cultural competence, learning and knowing about them with no need to ask any more questions. And these 2 things can definitely contribute to healthcare disparities by helping us improve healthcare and eliminate healthcare disparities.
Okay, and to bring back the topic of the Iron Triangle, the Iron Triangle once again is going to be made up of 3 components. It's going to include access, cost, and quality. And with the Iron Triangle, we have to always remember that there is a trade-off, which is inherent. No matter what, one of those components will suffer if we do improve 2 or one of the others. So like with access or with cost, if we want to lower the cost of healthcare, most likely the access will be sacrificed, or even the quality will be sacrificed. So when we talk about that in relation to health disparities, we have to remember that there is a direct correlation between the 2. Health disparities can be addressed, but we do need to know that within the Iron Triangle, there may be some sacrifices that will have to take place in order to improve those health disparities.
Talk about me part. I need a summary. Since these coverages provisions took effect in 2014, uninsured rates for the non-elderly population have decreased, falling from 17% in 2013 to 11% in 2015. Uninsured rates declined most sharply among the poor or near poor and among Hispanic, Blacks, and Asians. More statistics, Asians received worse care than whites for 20% measures. Asians had worse access to care than whites for 1 of 5 core measures. And that'll be all.
As stated before, the Affordable Care Act was designed to increase health insurance quality and affordability, lower the uninsured rate by expanding insurance coverage, and reduce the cost of health care. The provision of affordable health insurance to all segments of society is an essential part of eliminating racial and ethnic disparities in healthcare.
And once again, I'm Taylor Payne.
I'm Rattler.
I'm Winsika Neptune.
I'm Gadir Beck-Jones.
And thank you so much for tuning in to Rattler 850.